All right, so let's dive into this case like we're in the FRCR2B Viva exam. But let's keep it a bit relaxed. No need to stress too much, right? So looking at these images, what catches my eye first is this: subdural empyema. You can see that low attenuation collection right along the side of the falx cerebri. It's about 1 centimeter deep, pretty much extending along the right side. And oh, there's that midline shift to the left, which immediately tells me we've got something serious going on here. Now let's not forget to check out the sinus situation. Yep, there it is, extensive paranasal sinus disease. You can spot that high attenuation material just sitting there in the frontal, ethmoid, and maxillary sinuses. This really fits the bill for a subdural empyema secondary to sinusitis, especially since we're dealing with a young patient here. In my usual practice, I'd be all over measuring both the depth of that collection and the extent of the midline shift. I mean, the ventricles are small, and the sulci aren't as well visualized, which makes sense for a younger brain. You've got to think about that gray-white matter differentiation too. Yep, it's preserved. So what's the most likely scenario here? We're probably dealing with a subdural empyema, which is no joke, especially with that sinus involvement. I definitely want to evaluate the rest of the images for any intracranial abscesses, check the dural venous sinuses, and make sure that cerebellar tonsils are behaving at the foramen magnum. Don't want to miss any hydrocephalus here. Now, in terms of follow-up questions, I'd expect the examiner to ask about alternative diagnoses. Maybe a chronic subdural hematoma if there's a history of trauma, but with the sinus disease, that's less likely. They might also quiz me on the management. Definitely a neurosurgical referral ASAP, and we'd need to get this patient on broad-spectrum IV antibiotics right away. And hey, if you're finding this breakdown helpful, make sure to hit that subscribe button on my YouTube channel, Radiology Made Easy. Don't forget to leave a comment if you've got questions, and share this video with your fellow radiologists in training. Let's keep making radiology a little easier, one case at a time.